And when I went to the orientation, all I heard was, the beginning was, oh, you got to be off everything, the opiates and everything. And that just terrified me. But I went through the taper program. In my 4th week, I started the class, and I was just in so much pain. But within 10 days, I felt my pain getting better. And now I've been off the opiates for almost 2 years now. And yes, I live with chronic pain, but not the pain that I was in. Every day was a struggle. I could not control my pain. Now I can control my pain. I know now, looking back, that my pain, the severe pain, was driven by the opiates.
Hi, we want to spend a little bit of time talking about tapering opioids as part of the pain management rehabilitation program. So when I talk about opioids, I'm talking about pain medications that are medications like, for instance, Norco or Percocet, Vicodin, morphine, methadone, Suboxone, just to name a few. So medications that fall under that particular classification. And probably the most important thing to say about this is that all of our patients who come through the pain management rehabilitation program who are on opioids voluntarily taper as a part of their pain management program. And we'd really like to acknowledge that when we approach this subject, a lot of people are scared to even talk about coming off of opioids and what that might look like for them or how they might feel in that process. So we just want to say, we understand how scary it can be. And yet many of our patients who've gone through this process of tapering and then entering into the full phase of our pain management rehabilitation program often reflect on the other side of having tapered that their very first step in managing their pain was actually tapering off the opioids. Some of the common concerns regarding the use of opioids include debilitating side effects, opioid-induced pain sensitivity, physical dependence, and psychological dependence. The opioids have many side effects, one of which is the inability to experience pleasure or reward. Sometimes there's an impact also on one's ability to feel motivated from within. We have problems with nausea and constipation, as well as just a general feeling of sedation, mental fogging, or problems with attention and concentration, irritability, anxiousness, and an overall depressed mood. And there's a whole list of other side effects as well. But what you realize when you add them all up is that they actually add or complicate a person who has chronic pain in their life, and that it's hard to just kind of function through all those side effects and actually manage pain and have them feel a part of their daily life and connected to their life. So some other reasons to taper opioids include sensitivity to pain as a result of long-term exposure to the opioids. So in our clinical experience, we have tapered a number of patients now who, in retrospect, are able to actually distinguish or tease apart that much of their pain that they felt during the time that they were on opioids, now that they've tapered, has actually diminished or gone away completely. That there's a certain quality of pain that the opioids actually created.
When I started, I was in severe pain, and I was on a lot of opiates. Okay. And plus I had been on the opiates for many, many years. But I had more pain because I had been on the opiates for so long. I mean, I was hurting all over all the time. Pop another pill, and that's the way it went. And then they just sort of teach you what to do and how to do it, and the people in the class are awesome. So I have to say, overall, my pain level is fairly low now.
So another reason why we taper the opioids is this process called physical dependence, whereby just the presence of the opioids in the system, it changes the system, and the system starts to adapt to the presence of the opiate and needs more to achieve the same effect. So what you see, sometimes quickly and yet sometimes for some people more slowly over time, is an escalation in the opiates in order to cover their pain. What happens when the medication starts to wear off is withdrawal begins to happen. And ironically enough, funny enough, the first sign of withdrawal with the opiates is actually pain. So you end up into this vicious cycle of needing more to achieve the same effect, growing higher tolerance, being in what we call intradosing withdrawal, which means that as the medication wears off in between doses, you have withdrawal pain and other withdrawal symptoms that you then take opiates to get out of. But ultimately, you are taking opioids for the withdrawal pain caused by the opioids. So in the end, what you end up realizing is that the opioids have caused pain. Many of our patients, in looking back over their experience, realize that in fact much of their pain was driven by opioids.
It was like a dog chasing its tail. You know, I just couldn't get off of them. I tried doing it a few times myself, and I was deathly ill and couldn't do it. And I thought, how am I ever going to go down to like one or none at all? It's like, it's not going to work. And it did.
So another complication of opioids in treating chronic pain is what we call psychological dependence, which again is just another fancy way of talking about how somebody thinks about the medication as their pain relief. And so what we find is that many people end up organizing their entire day around the dosing of their opiate medication and become reliant on the medication in order to go through their daily lives and proceed with their daily tasks.
Get up in the morning, take my wife, take some pills. Take my wife to work, take some more pills. I don't want to do that anymore. So when he said there was another way, I was ready.
As I mentioned before, we are really sensitive to the fact that many people are afraid of tapering and are afraid of actually being in withdrawal. Folks, by the time they come to us, have already oftentimes experienced abrupt, what we call acute withdrawal, or the sudden onset of withdrawal as a result of not having their opioid medication for whatever reason. And some of those symptoms are actually quite painful, very debilitating, feels very much like a very severe case of the flu. And it's a very, very unpleasant, painful experience for some people. And if you've had that experience prior to coming to our clinic and getting assessment, you might be very fearful about the process of tapering. And so we want to assure you that we are here to make it as comfortable as possible, to support you and educate you and help you manage withdrawal symptoms, and to taper very slowly over time so that that discomfort and that pain is minimized, and that we can help assure you a safe tapering process.
You don't realize it, but it's just so much easier the way they taper you off, where they help you. They give you other things to help the nerve endings and things like that that really helped a lot. And they monitor you every week. They're always calling you to see how you're doing and everything. Wow. They're great.
As you may recall from the What is Pain chapter, awareness is essential. It's the #1 tool that you need in order to retrain your brain and nervous system. We are very cautious about the use of other substances that also can potentially block awareness. Other substances such as alcohol and cannabis, benzodiazepines, or agents that are given for anxiety, things like Klonopin or Ativan, Xanax, Ambien, for instance. And even nicotine and other stimulants are agents that we're concerned about in terms of their impact, again, on the awareness. And we'll be talking with you about those particular agents and their role in your particular life and what the concerns could potentially be going forward. And we work with your providers around those particular medications, but it's something that we're cautious of and something that we view as a part of your treatment plan, because again, we want you to be able to have as much as possible full awareness of your internal experience so we can begin to help you to retrain, re-educate your central nervous system. We understand that tapering the opioids for some people can be scary, and so I want to thank you for viewing this video and taking the time to learn a little bit more about taper and the opioids. And if you have any further questions or you wonder what a plan might look like for your particular situation, feel free to take the next step, and we'd be more than happy to sit down with you and evaluate your particular case. Many of the patients before you that have come through our program, and again, in retrospect, have looked back and to realize that actually tapering to opioids was their first step in learning to manage their pain.